Okay, I'm here with Christina Rennie, Clinical Director of Patient Safety and Consultant Ophthalmologist, University Hospital Southampton NHS Trust. So you have a session going on tomorrow at 4 p.m, the Patient Safety Incident Response Framework. Could you just explain that?
Yeah, absolutely. So across the whole of the NHS in England, we're now seeing a change in the way we do patient safety incident investigations. Mm-hmm. It stems from the fact that we know over the last 20 years we're doing root cause analysis, and actually it's really had very little impact in terms of preventing things from happening again. We're still seeing the same incidents happening again and again. So this new change is a different way of approaching investigations, mm-hmm. but a systems-based approach. It's about really involving the patients and families who've been involved, and also supporting staff who've been involved in incidents. Mm-hmm. And the idea is that when we get the outcomes from our investigations, it's about looking at what things we can put in place at a systems level. So not just saying to that last person, oh, don't do that again, and go and reflect on what's happened. Mm-hmm. We put in place systems things so that we really reduce the risk of something happening again. And also, really importantly, we look at outcome measures. So how do we know that our changes we've made have made an impact? So it's all of those together. Yep. Then underpinning all that is the approach we have to the culture around safety. So not just looking and learning from when things have gone wrong, but also learning from the everyday, understanding our risks, and knowing how we can deal with those before we have things going wrong. Mm-hmm. And something about the way we all interact, the psychological safety, so that we all feel able to speak up and discuss risks and try and prevent things from going wrong before they actually happen.
Yeah. And what would you say the current status of that patient safety culture in the NHS is at the moment?
I think it's variable. So there are some places of really good practice and other areas where we find pockets where it's not so good. And that's, I think, the key now, is this is an opportunity for us to reflect and look at how we're performing in our own areas. How can we improve? How can we build those safe psychological spaces? How can we encourage people to speak up? When people do speak up, are we listening up? Are we listening to what's being said? And are we following through with actions afterwards?
Mm-hmm. Brilliant.
Brilliant.
Christina, thank you very much.